Hey everybody, it's Eugene Driscoll of ValleyIndy.org. Welcome to Navel Gazing, the Valley Indy podcast. I'm recording this at 4:21 p.m. Friday, November 13th, Friday the 13th. My guest will be Dr. Frederick Browne. He's Griffin Hospital's chief medical officer, and we're talking COVID-19 in the Valley. But before we begin, I just want to read a quick note from our sponsor, ValleyGivesBack.org. While giving is always in season, now is a great time to plan your gift. Name a Valley nonprofit in your estate plan and create a legacy that tells future generations what mattered to you. With a planned gift, you have the power to impact the Valley forever without affecting your current lifestyle. Your action will inspire others to make a difference in their own way. Remember the Valley. Ask your accountant, financial planner, or attorney about planned giving options. Plan now, give later, impact tomorrow. Learn more at valleygivesback.org.
For hundreds of years we've brought you the news. Printed the info, we gave you the clues. Owners' profits were always sky high. Changing market now threatens our lives. Post-literation, critical reading, dumbed down nation, signs have been breeding. TV sucking ideas from our head. Public discourse just about dead. We'll ride the dinosaur. Yeah, ride the dinosaur.
Joining me on the line, I'm very excited for this conversation, is Dr. Frederick Browne. He is Griffin Hospital's chief medical officer. Hello, Dr. Browne. It is nice to hear your voice again.
It is great to be on, and great to chat with you today. It's again a real pleasure, and it's a pleasure to be able to get sort of what's going on out to the community.
And so, Doctor, we were just talking a second ago before we went live. I was sort of explaining to you that I'm coming to you from a source of frustration a little bit. I'm sort of overwhelmed, and we get these numbers every day in the Naugatuck Valley about positive cases that are happening. And every day I watch Governor Lamont come out and he does a press conference and he answers sort of statewide questions. But I have a really hard time getting a sense and tracking what's happening with COVID in the Naugatuck Valley specifically, and Griffin Hospital especially, because that is the heart of our community, and that's our community hospital. So, I mean, just as we were going live, there are just some new numbers from the state of Connecticut showing that we had 2,746 positive cases today, Friday the 13th, November. A positivity rate, I believe, up in the 6% range, if I'm getting that correctly.
Right.
Definitely not. There's more testing going on. That's the other thing going on. So, Doctor,
yeah,
you're in the know. You're dealing with this every day. What's the situation like at Griffin right now in terms of COVID?
Absolutely. So I think you hit on a lot of different points there that I think is really important. The first one that you hit on is the testing. So a big difference, and I'm going to compare sort of what's happening now in the second wave versus what happened in the first wave. There is a lot of testing going on versus the first wave. If you remember, I had a statistic that I used to do and lecture on when I was talking about this in April. If you looked at the amount of people in late March who were actually tested in the entire country, the amount of people who were tested, it was only 60,000 people. That was it in the entire country, in the entire United States. In the middle of March, when we already knew it was in California and it was hitting New York, and we still only had such a number. Where now we're doing that. I mean, in the state of Connecticut alone, that's probably a day here. So we are testing so many more people. I think we've been very active in surveillance. I think people are, if there is a concern that someone had any exposure, we're getting them tested, and having the availability of that test is really important. Has helped us sort of manage this a little bit better than we did in April. So we're really on top of sort of where it is and what's going on. So those numbers, even though this is the second wave and we are definitely seeing more, I think those numbers are going to look really outrageous because we were testing so many people in the term they're being positive. Let me tell you also what we're finding as the difference. So in April, people were coming into the hospital and they were really sick, to the point where they were going into the intensive care unit, and a lot of people had to be put on ventilators. It wasn't as high as we initially predicted, but it was still very high. And in certain areas of the hospital had to be shut down. And unfortunately, people were we were having, people were dying. And it was unfortunate. I could tell you that this second wave is not looking as bad. At least right now, we are having a lot of positivity, but we're having a lot of people who are coming into the hospital and a lot of people who are being discharged within a few days. So as opposed to being here for a week, they're here for 3, 4, 5 days max.
Why?
And then they're going.
Like, what's the difference between?
I'm not. You know what? I don't think anybody's exactly sure why. It may be. There's a couple maybes. It may be the fact that we are protecting our elderly population, that we're protecting our nursing homes a lot better than we were before. I think that's potentially there. Or, there was because of the first wave did hit a lot of our vulnerable population. That could have been one of the issues. The second thing is that theoretically, a virus like coronavirus is going to undergo some evolutionary pressure as it progresses. And if you can follow my explanation on this, and again, it's a very logical explanation of what happens with a virus, especially in an aggressive virus. So an aggressive virus will actually infect a person. So if you have a person that's infected with an aggressive virus and someone who is infected with the same virus, but it's mutated a little bit and it's not as aggressive, what can happen is that person who's infected with that aggressive virus, they get really sick and they self-select out. So what will happen is they'll actually go home. They won't interact with people, not because we tell them not to, because they just don't feel well. Mm-hmm. They're sick. They just don't feel well at all. So they'll self-select out. The person who is not as sick, the person who is either mildly symptomatic, they're actually going to probably interact a little bit more with other people. Even though we tell them they shouldn't, they're going to interact a little bit more with other people. What happens is that more people are then in contact with someone who has a milder version. And that milder version ends up being the more predominant virus that's in the community. So that's another theory that happens. And that's actually typical of most viruses. So it's evolutionary pressure within the virus to actually focus on being a milder disease, because then you can affect more people and then you continue to live longer as a virus. So that's actually a possibility. And then the third one is that, more healthy people are getting infected. And we do know that about 95% of the people who actually get infected actually do completely fine. They may have mild symptoms. They just completely recover. They don't even go to the hospital. 95% of them get better. 5% can get sick, and then 1% of that actually can get really sick. So we may just be seeing those people who didn't get it the first time are just natural progression, that they're healthier and they're able to respond. But we're definitely seeing that within the hospital.
Yeah, and then in terms of the number of people that have been coming in recently, I mean, we're seeing an uptick in hospitalizations according to the State Department of Health statewide.
Correct.
Is that being reflected in Griffin? I know Griffin took a lot of measures to prepare for that first wave as it was arriving in Connecticut. I don't think Griffin ever hit its maximum capacity, and I've heard that hospitals the second wave are all pretty well prepared for whatever should happen. But what types of numbers are you seeing in the hospital now?
We've definitely seen an uptick, just like everyone else has. So it's definitely an increase, and it varies day to day. So we continue to see an increase. But as I said, it varies depending on the time of day. I mean, as I said, just today alone, we've had probably about 8 discharges discharges of people who actually had COVID. So we're seeing more people come into the ED, and I think that corresponds with the Naugatuck Valley Health District. I think the numbers that you see, that there's been an increase. If there's an increase that's in the community, then obviously we see an increase at the hospital. Those who are sometimes the worried well, they have COVID-19, they're concerned, so they'll come into our ER. There's some people who are a little sicker, who need IV fluids or maybe a little oxygen. We bring them in, and then they get treated, and then they basically get treated. We watch them for a period of time, and then they get released. And then there's looking at that that 1%. We do have the possibility of 1%. So one person, one or two people can potentially go on the ventilator. So as I said, we're seeing and I could probably give you a sort of percentage. It's still a low percentage, probably about 10 to 15% of our patients are COVID right now.
Okay. And then, Doctor, the other thing I wanted to ask you about that once a week, the State Department of Health sends out this, for about a month now, sends out this COVID map, a color-coded 3-tier map. Yeah. And we've all read, we've all become sort of statistical experts, except me. And we've learned this week, if you look, first it was 11 towns the first week, and then it was, I think it jumped to 30, then 68. Now it's 100. 80% of the population of the state of Connecticut is living in this designated COVID red zone. And that means if you have a daily 2-week average of at least 15 cases per day, you make that red list. Schools should think about remote learning, from what I'm told, if it hits 25. And, Ansonia is in that now. Derby had a jump in a week with that 2-week average. But I guess what I'm trying to, I get what that is, and it's colored red and it's sort of dramatic. But what are the statistics you're looking at? And I guess you've said, maybe answered this question, but I was sort of surprised by this big jump that, like, Derby, let's say, took from, I think, 17 to 30, roughly, in that weekly COVID map. Do you look at that? Is that something that concerns you?
Yeah. So we do look at that, and we obviously follow that along with you and the rest of the Valley on sort of what's happening in the community. We also do an extensive amount of testing. So we do testing outside of our hospital. So we sort of see the numbers sort of roll up. We see that there has been an increase depending on the areas that are. So we do watch it because we know that, given that given the more people that are positive, the likelihood is that we will have more people who will be admitted to the hospital. So we need to make sure that we're prepared. And as we've talked about before, we're prepared in a lot of different ways. Our ER has a set area that is designed for COVID patients. We have a wing that is negative pressure and designed for patients who are COVID positive, so we can optimize their care and then prevent any spread within the hospital. Which, again, I'm more than happy to say that there hasn't been no employee to patient or patient to employee spread within the hospital this entire time. So we're actually really proud of that. So be very careful about doing that. I think it's interesting, and honestly, I got to tell you, Eugene, this is something that I somewhat expected. Probably not as high as it is, but I did expect this to happen about this time. Maybe a little bit more late October, not necessarily mid-November. So a lot of things happen around this time. School did go back, and again, I think that was really important that we had school that was going back. As school goes back, some people feel a little bit more comfortable. Children feel a little more comfortable sort of, spending time together. In particular, the colleges and college students having a tendency to be together. And sometimes, around this time, not being super vigilant with the PPE and infection control practices leads to the spread. So all it takes is one or two people who actually have COVID, and then they go to I'm gonna throw the college kids under the bus here, but they go to a college party. That's okay. We all get it. We're all college. We're all college students. We understand. So all it takes is one or two college kids, and they go to a college party, and they're not wearing their masks, and all of a sudden, there's this connection, right? There's all of a sudden this single thing can start spreading to a bunch of different people who, again, are sort of in that mild category. They're not really getting that sick, so they don't feel that bad. So they're potentially spreading it on to each other. And then when the holidays come, they go home or they have any interactions with their family. All of a sudden, now you're having this spread where it's now from the college kids to their parents, and then we want to avoid parents to grandparents because grandparents are our risk area. So that happens around the season. This happens every year with just regular viruses, not COVID-19. But every year, school starts, and then around October, November, that's when all the upper respiratory tract infections occur, the gastrointestinal tract infections occur. All those occur really around this time. The other thing that happens at this time is the weather gets colder. So all the time that we spend outside, all the time we're around UV lights, all the time that kills all these viruses. We start to close our doors and close our windows, and we're getting a little bit closer to each other, and that's a great way to sort of spread different types of infections. So all those things were sort of occurring together. So having COVID-19, which is again a brand new virus to us this year, to actually now have it in a little bit more of a closed environment allows it to spread, much more rapidly. And I think honestly, probably Halloween had a little bit of this to do. I mean, we felt pretty comfortable around Halloween. There really wasn't an uptick. And I don't know about you, but I kind of noticed in my neighborhood there was definitely some parties that were going on. Mm-hmm. And as being super observant, looking around and seeing, there weren't a whole heck of a lot of people wearing masks.
Yeah. Let me just jump in there for a second, because there's one thing I wanted to just ask you. I mean, maybe I am high alert because I read about this all day, and then I get the report every day, and every day I've been trying to write a story about what's going on with COVID locally, and it sort of gets into your brain. But then you're in the know. You're a medical doctor. You're in the field literally, and you're coming across as calm. But then I think, okay, wait a second. You're just saying common sense stuff here. And then I think about, I exist on Facebook, and I always get from readers on Facebook, well, this is just the flu. And look, what the doctor's saying right here, he's being calm and collected, and he's saying nothing different than we should know when flu season comes around. Is that a dangerous train of thought, or is that what it is?
So it's a little column A, column B on this one. So let me explain that. So it is like the flu. It is not the same as the flu. So the difference between the flu and COVID-19, so again, they're completely different viruses. So there is actually this, probably not common, but I've heard this several times, is that, if you get the flu vaccine, it works for COVID-19. That's actually not true. Just so everybody knows, you should still get the flu to prevent the flu from occurring, but not from COVID-19. There are some similarities because the flu and COVID-19 are both viral respiratory tract infections. So that means they're actually spread by droplets. In particular, COVID-19 is more likely to be a face-to-face contact. It's probably less where the droplets get onto a surface and then you touch your face. It can occur, but it's more likely that you're very close to someone and then they actually spread some of their virus to you, I guess is the best way to put it. Mm-hmm. That's sort of what it is. So it is. The big difference between COVID-19 and the flu is actually our immunity to it. So we see the flu every year. And even though there's mutations to the flu and we should get the flu vaccine, every year either we're getting some exposure to the flu or we're getting the flu vaccine to enhance our immunity against the flu. That's a big deal. COVID-19 is brand new. We've never seen it before. We didn't see it last year. It's a brand new virus. So what happens is that because we've never seen it, we have no prior knowledge. Our immune system has no prior knowledge about this virus. So what happens is that when we get exposed to it, we get infected with it. And so the infectivity when you're not wearing a mask is really high. And that's the biggest concern about it. So different from the flu, because not everybody ends up getting the flu, right, in the season. Mm-hmm. But with COVID-19, everybody can potentially get COVID-19 if they haven't had it already.
Okay.
And that's the difference. So and then you take that and you compact that together, the flu season could be as long as 6 months. And because the flu virus is always looking for someone who is capable of being infected, didn't get the flu shot, didn't have it previously, doesn't have antibodies to fight against it. COVID-19, there's no barrier for someone else to not get it. So if you and I didn't have it, and then someone didn't have COVID-19, and someone came along and had COVID-19, you and I are susceptible to getting that infection. However, if someone had the flu, and let's say you didn't get your flu shot, but I did, then there's a less of a chance for us to get it, right? Because you may even have some immunity to it. Mm-hmm. So that's the big difference. So it actually has to do with the concept of a novel virus. And that's when we initially came out with this coronavirus, we called it the novel coronavirus because it's brand new from animals to humans and humans to humans.
Gotcha.
Does that make sense?
Oh, absolutely. Absolutely.
Okay.
The other thing I wanted to ask you, Doctor, is in terms of, and maybe this is impossible to answer, but I'd like to ask it anyway. In terms of where COVID is happening in the Naugatuck Valley right now, and obviously HIPAA is HIPAA. I understand that, but is it? You had mentioned before. Is it small gatherings that are helping to spread it a bit in the valley? Is it restaurants that are open? Is it, is there any particular pattern that you're seeing generally speaking right now?
So really tough to answer that, because right now we're seeing it pretty much everywhere. And it really, I think the biggest probably spreading was gatherings. So as people are gathering together and not wearing their masks, that became an issue. I can tell you, from my standpoint, and one of the bigger concerns is that it's starting to get into into families. So there may have been a gathering, but now it's actually in people's homes. And what's happening, same sort of thing we just talked about. So what's happening is that if someone's spouse or child ends up getting it, the likelihood that everyone in that household is going to get it is actually pretty high. So I think what we're seeing now is there was probably an initial nidus, probably related to some sort of gathering, and then without wearing masks. Because again, I keep reiterating, if you're wearing a mask, the likelihood for you to transmit the disease is actually, if two people are wearing masks, it's less than 1% likelihood that you're gonna spread this. It's actually really, really low. As soon as you take that mask off, it goes exponentially, your likelihood for getting it. So I think there was these nidus of groups, and then as these groups sort of went back to their homes, I think that's when, and most people go home, and I'm the same way. I don't wear a mask when I'm at home.
Right.
They end up spreading it to their family members. And I think we're seeing more of that, where family members, so instead of seeing one person from a family being sick, we're seeing several members of the family from being sick. So I think that's what's happening right now.
And then in terms of schools, this is another, I won't take up too much of your time. I realize once you have a conversation about COVID, there's so many different
avenues.
Absolutely. You could talk for days.
We could, and I could talk for hours, so just watch out.
Yeah, well, no, I really do appreciate that. But, my kids have been home. We just finished up our second week of remote learning. They're scheduled to go back to their school Tuesday. They go to a magnet school in Bridgeport, which has that 2-week daily average in the 50 range. So that's something I think about. Derby hasn't had many cases within their schools, but that rate again is in the red, like all Valley towns. What's your take on whether remote learning should be undertaken? Because I'm a little confused. Because on one hand, Governor Lamont and the education people say, well, stay in as long as you can, because kids, of course, need to learn, and in-person learning is the best, especially for kids from challenged communities. In terms of economics and all that. But then on the other side, the state says, well, if you're at that 25 rate, you and I'm getting a spam call from Iowa City. I apologize for that. But I'm going to let that beep, because if I don't want to hang up on you. But on the other hand, the state has these guidelines saying, well, if it's at that 25 mark, you should really think about remote learning. And then I know parents are struggling with this like crazy. Do you have any advice for that?
I do, and listen, I'm going to go ahead and couch this a little bit and say my opinion. And again, I could tell you, sort of being a healthcare worker, being an infectious disease doctor, and an epidemiologist, I'll give you sort of my opinion on this. And again, there may be some experts that disagree with this, but I got to tell you that I've been very impressed with the schools, and their ability to monitor how children are, not only learning, but how they are socially distanced, how they're wearing masks, and then when there is someone who becomes positive, they are proactive in basically finding that child, and then those who are around them, and appropriate quarantining them. So in a way, I feel that schools are safe, really safe. I think they're doing a fantastic job. So I think and then obviously from a physician standpoint, I think the point that you made about having children socialize and be together and be able to have that interaction, I think that's really important. We don't want our children to not be able to interact with other people. That's so important for us in our human development. So I personally feel that the schools are doing a great job, and if we can keep those, that face-to-face learning in a school that's being very vigilant about it, I think we should. You know what? If it gets too high, what happens is that it's not the school that becomes the issue. It's about the people who are potentially coming in with it. So if the teachers are coming in because they've been potentially affected by family members, or the students because they've been infected by family members or by other students outside of the facility, that's when I think you have to take those extra steps to make sure that you're doing, to prevent that from, becoming widespread within a school. Does that make sense? So really, it's not about the school itself. It's about sort of what's happening outside the school. I've heard some arguments, and again, not that I'm advocating this, but I've heard some arguments, just keep kids in school the whole time,
right.
So they can just stay in school and we're good to go, because again, our educators are doing a great job at monitoring that and being very proactive about, following the rules and making sure that people are safe, as well as the students, as well as the teachers.
And I've been amazed. I've had conversations with Dr. DeBacco down there in Ansonia, and just how, first of all, these schools in March and April had to mobilize and get laptops out to thousands of kids. Basically, nothing that I've seen in my lifetime. It was a wartime effort. And now their entire day is dealt with in Ansonia. It's been sort of contact tracing and trying to keep the kids safe.
Right.
It's really amazing what they've done.
It really is.
And they've brought in. I think we read about schools so much in the press in Connecticut is because they are so open. The schools are telling us what's going on, which is very much appreciated. And I guess, all right, so what I'm getting out of this conversation, and correct me if I'm wrong, is that you got to wear your mask. The guidelines, regardless of what you may feel politically or otherwise, that has nothing to do with what we're talking about. If you want to keep yourself safe and others safe and your family safe, follow the guidelines. And I imagine that will include, with Thanksgiving coming up, this limited gathering that I'm arguing about. Me and my wife are just literally arguing about this the other day. But you're saying follow that stuff, please.
I really am, and honestly, we've even though you hear me say it's not as bad as it was in April. Because there is that chance. There's that 1% chance that someone could die from this. That's too high. So make sure that you're taking those extra precautions. And you're right. Thanksgiving is one of those where we gather together, figure out an alternative way to do that. Because if I see anything, it is the family gatherings, the social gatherings that are the ones that are actually spreading it, and then bringing it back to places of work and et cetera. So unfortunately, we're going to have to take a little bit of a breather, let this wave sort of settle down. And hopefully we'll get back to normal, and we see if we can get this vaccine out.
Yeah, and that's looking good too from the reports that came out earlier this week. So, all right, Dr. Browne. I guess just the one thing that I don't know if you wanted to mention is I can put it in the article, and I've been spreading it all over social media as often as possible. Is the testing is available at Griffin Hospital. You can call a phone number and use the keyword community to you don't need a doctor's note. You can get tested. That's happening in a big way, correct?
Absolutely. So Griffin, and hopefully we'll be able to make sure this is on the website. And so, yes, Griffin has actually worked throughout the state to develop testing and sort of perfect the ability to test patients. And those now, because we're doing community outbreaks and community pop-ups, is what we call them, we want to make sure that we can test anyone, and you do not need to have a physician's, so if you use the term community or there's a community outbreak, you do not need a physician's order. We have it here on campus. We also have at the Ion Bank in Naugatuck and in Quasi Park. And again, those are all on the site, so if people need to get them. And again, this is something that we can do for our community with the support of the state and local government to make sure that we can make sure that everybody's safe.
All right, Dr. Browne, you've talked me off the ledge. I do.
Great.
I
Great.
really,
We shouldn't wait as long. We should not wait as long. I'm happy to talk to you anytime.
All right, now I know. I'll stop banging my head against the wall and sending out angry emails on weekends to PR people.
Not necessary.
I'll just reach out direct. All right, Dr. Browne, thank you again so much for your time. I really do appreciate it.
It was my pleasure.
Take care.
All right, bye-bye.
All right, so that was Dr. Browne, the Chief Medical Officer for Griffin Hospital. This is Eugene Driscoll. I'm going to try to upload this as soon as possible, unedited. I want to thank, I already thanked Dr. Browne for his time, but I hope people get something out of that. So for Valley Navel Gazing, this is Eugene Driscoll, and this is the Bad Slugs to play us out. By us, I mean me.
Hundreds of years we brought you the news. Printed the info, we gave you the clues. Owners' profits were always sky high. Changing market now threatens our lives. Post-literation, critical reading, dumbed down nation, signs of inbreeding, TV sucking ideas from our head, public discourse just about dead. We'll ride the dinosaur, yeah, ride the dinosaur. Our readers are in the opens each day, yeah. Online clickbait a prurient way, yeah. It's free information here to stay, yeah. Not even hookers give it away, yeah. Advertising, metastasizing, newsroom shrinking, constant attrition. We'll ride the dinosaur, we'll ride the dinosaur. Dinosaur. Deadlines, bylines, pictures too. An editorial comment for a buck or two. Fire down the block, the murder next door. And now we wonder what it's all for. Social media coming free to you, funny pages, the mayor's wages, criminal seats, corruption schemes, ink state wretches asking tough questions. We'll ride the dinosaur, yeah, ride the dinosaur. The presses are running all through the night. We're printing the truth with all of our might. We're platform agnostics, got that interweb too. Buy an ad, see what we can do. We still have subscribers, still have our fans. We're here every day, so give us a chance or we'll make an art stand. Just hold us in your hand, and we'll ride the dinosaur. Yeah, ride the dinosaur.